Good morning. Can everybody hear me all right? All right, good morning. Thank you for joining us here today at Monroe Community Hospital. I want to first start by recognizing Technical Sergeant Jesus Perez here to my left and the 96 soldiers who were sent to Monroe Community Hospital to help care for our residents and patients. I also want to recognize Alyssa Tallow, the director here at Monroe Community Hospital. I also want to start by thanking Governor Kathy Hochul for sending in the National Guard to assist us with our staffing and care needs that we have for our residents here who came from all the different healthcare systems here. Obviously, months ago, we faced in our community a crisis that required a larger response, and when I spoke to the governor and she asked, what do you need here in Rochester to help with the nursing homes and the hospital systems, my answer was, we need help in the nursing home. And she didn't hesitate in activating the National Guard, and I want to thank the governor for doing that. The National Guard has been in Rochester for about 6 months. They arrived in early December. And without their help, Monroe Community Hospital would not have been able to take in some of the most vulnerable patients and residents that we've seen through the pandemic and relieve strain on our hospital systems. Because of the National Guard, Monroe Community Hospital was able to accept 182 patients and residents. It's 182 additional people we were able to care for here because of the presence of these men and women. That's 93 long-term care patients and 89 short-term rehab patients. It's 182 of our neighbors, our family members, our loved ones who were able to get the care that they need during a tumultuous time. And it was all thanks to the Guard. And that helped to reduce the backlog of hospital beds that were needed for those who needed critical health care needs and surgeries. The Guard helped staff patient care as well as provided much needed support for cooking and food service and to other departments that were short-staffed during the pandemic. National Guard also assisted at other local long-term care facilities in the community. These soldiers sacrificed nights, weekends, holidays, time with their family, all to help those in need and those who are most susceptible to a rough course of COVID. These soldiers answered the call during the greatest healthcare crisis of the last century, and they served their state, nation, and neighbors in the process. COVID exacerbated a healthcare staffing crisis that predated the pandemic, and the National Guard soldiers answered that call to service in a desperate time of need. On average, there was 26 New York National Guard personnel staffing Monroe Community Hospital. But overall, nearly 100 Guard members from every corner of this state, we had people from Long Island, the Adirondacks, the Southern Tier, all came here to give their time, talents at Monroe Community Hospital, including Guard members from right here in Rochester. This is an example of partnerships working together for the greater good. It's different governments, it's different systems all coming together to solve a problem other than operating in silos. And that's something we've learned throughout this pandemic as a way to address the issues facing this community. We're never going to succeed if we're all operating in silos next to each other. We have to learn how to break down those barriers and work together. And this is a great example of different levels of governments, different communities, the healthcare systems, the National Guard from various walks of life, everybody coming together to help our older residents. So I want to thank our health director, Alyssa Tallow, the Monroe Community Hospital team for their important work that they do for our older residents. We have a member of our team who are out here as well, and I want to thank them for working every day to keep the residents here healthy and safe. And I want to recognize, and I also want to thank our staff for the resiliency that they have shown, and our team for the resiliency that they have shown throughout this pandemic. This has been very difficult. Every piece of the healthcare system has been challenged and stressed over the last 2 years. But the men and women who work inside this building, they're healthcare heroes. These are the frontline workers who are protecting the most vulnerable people in this community, and they deserve our thanks. They have been working around the clock in very difficult circumstances, and I want to thank them for the work that they do. So again, once again, thank you to the National Guard. Thank you, Governor Hochul. I want to thank the leadership here at Monroe Community Hospital and the entire team here, everyone working and from environmental services straight up through administration for all the work that they've done to keep our neighbors safe in this once-in-a-lifetime crisis that we've had to deal with. So to provide thanks to the Guard and show our appreciation, I have a plaque here that I'd like to present to Technical Sergeant Jesus Perez, who's leading the team here. We have a plaque here to say, with greatest appreciation to the New York National Guard for your unwavering commitment to the health, safety, and security of the people of New York, and for going above and beyond to care for the residents of Monroe Community Hospital and other long-term care facilities during the COVID-19 pandemic. Sir, thank you. Thank you very much. You're welcome. You want to say a few words?
Thank you, County Executive Adam Bello. Good morning, everyone. My name is Technical Sergeant Perez. I'm the non-commissioned officer in charge assigned to Monroe Community Hospital. During our time at MCH, I've seen greatness amongst our troops, some of which are combat medics and EMTs. Others have been trained to become temporary nursing assistants to take care of our community's loved ones. Many of these individuals are volunteers that came from all over New York State, including the 5 boroughs. Our service members performed each task to the best of their abilities, and I'm proud of them. I want to thank all my service members for their hard work and dedication throughout this mission. I would like to also thank Alyssa Tallow, the Executive Director of MCH, and her administrative staff for the support they provided us throughout this mission. Thank you all for your time. Have a wonderful day.
All right, great. Thank you. We can take any questions the media might have. Yeah. Yeah. Sure. Yeah. Yeah, I can speak to that. Yeah. No. The challenges in the healthcare system and staffing the healthcare system are certainly not solved. This is something that's going to continue into the foreseeable future. But the county's taking a few steps. We announced just a couple weeks ago the expansion of our Empower program, which is a healthcare training program, because what we need to do is really build the workforce. We need more workers. We don't have enough workers in the field. And we do that by training, and so we're bringing more people in. And this is actually something the National Guard has been able to help us do by being here and stabilizing the nursing home, allowing us to care for residents. We've been able to hire more people in, focus on training, and that's been able to help. That's going to help in the mid and long term. But we have to continue to do that. We also just announced just a couple weeks ago, as part of my State of the County, what our focus is going to be as a county government and also as a community. And one of them is workforce development. We have got to incentivize more people throughout the system. It's not just here, it's the whole healthcare system. We have to incentivize more people into the system. And we do that through job training programs. We have to figure out how to pay people to go through the training, how to pay for this training. Whoops. And then we also have to make sure that we're paying people fairly. As part of that, the county, I introduced a proposal in the legislature to increase pay rates for our county team, including the staff here at Monroe Community Hospital, as well as to pay additional incentives over the next year and a half for recruitment and retainment purposes. So we're really investing in our workforce, and we need to do that as a whole system, not just here. Yeah. Yeah, so over the last several months, obviously knowing this can't go on forever, we've been able to stabilize, bring in additional staff to be able to care for the residents. So our residents will be cared for when they depart today. Yeah. Yeah, we're gonna be able to maintain the census that we have now. As a matter of fact, I think we actually grew the census by a couple over the last few weeks, but we're going to be able to maintain the census that we have now. Yep.
So some of the work that we accomplished while on mission, we are taking care of a 566 bed facility. So anytime any of the residents here need something to be fed or changed, our service members were able to provide cares to the residents of this facility. We also had cooks and kitchen prep staff as well that were able to provide meals and nutrition to our residents. We also had administrative staff, HR staff, and residential services, which provided morale to the facility as well.
What kind of work have you done before this, and how did that at all translate to what you did here?
This is a very unique mission.
Can you talk a little bit about what your previous missions have been and sort of what that work, what led? This was voluntary or this was assigned mission?
So for some it was voluntary, for others it was involuntary.
What's next for you guys? Is anybody from Rochester area?
I am.
Oh, definitely. So you were able to find a balance. It wasn't like on mission you were in this hospital all day, every day.
So we do have our shifts that we work. It's 12-hour shifts for the administrative staff and for the TNAs. Other administrative staffs, they had 8-hour shifts. So everybody had their work-life balance accordingly. Administration helped us transition into our roles, get us trained up to help take care of the hospital. That's all I have on that comment. We're definitely. The place is up and running. They're able to hire more people, as County Executive Adam Bello said it earlier.
So when can I actually give an example? Let me give you an example. I think I know what you're getting at. So let me give you an example too. So here's a good for instance. So if you back up 6 months ago, it was very difficult to keep the cafeteria open, for instance, to be able to keep it open for visitors, right, and staff. But having the National Guard come in then, they're able to stabilize that so then we can bring in, hire, recruit, and bring in new cafeteria workers. They were able to stabilize that for us. We bring in those workers. Now the cafeteria is open, and it's sustainable, right? So that's a benefit that the Guard had, is they can come in, they can look at different units, different functions, help stabilize those functions so that we can recruit, retain, bring more staff in, and then also be able to care for the additional residents that came in, right? So they were able to basically come in at different functions throughout the building. Does that sort of help answer a little bit? Yeah. Yeah. Yes. This is the last day. Yeah. But we can't let them leave without saying thank you. I mean, this is a community. Monroe Community Hospital is a treasure here in our community. It cares for some of the most vulnerable residents that call Monroe County home, and some of the most affected by COVID as well. And so these men and women, there's just a few behind me today, but there was over 100 that were here working out of this building from all over New York State for the last 6 months, caring for residents that came from both hospital systems, residents who came in from the community that needed that care, and they came in and they helped provide that for the whole community. And so we all, I think as a community, not just me, not just the team here at MCH, we owe them a huge thank you for the time they took away from their families, from their jobs and careers that they have to be here to fill that need, not just for Monroe Community Hospital. We just happen to be the place that we were able to work out with the state for them to go. But they really served a function for this whole community, so we just want to say thank you. Yeah.
This will be the last day for the soldiers and airmen today.
Yeah, today's last day. Okay. Awesome, thank you guys. Awesome, thank you. good. And I lost my phone. Oh, there it is. Phil Barber. Nice to meet you. Thank you.